Good morning, Dr. Devroy. Thank you so much for your time. Really, really great to see you again, as always. Could you just give us a bit of a background about who you are, your training, your experience?
Thank you, Emily. Good morning. My name is Dr. Devroy. I did my initial training in India, in Pune, where I completed my master's in ENT. After that, at the age of 25, I went to the UK, where I underwent training in ENT and head and neck surgery in Glasgow rotation, as well as Liverpool. After my rotation, I was appointed as a consultant at Alder and Royal Liverpool University Hospital. After about 2 years, I decided to do facial cosmetic surgery. So I did a fellowship in France, in Nice, in Hospital Pasteur, and then I passed the American board and European board in facial plastic surgery. So I'm one of the first few ENT surgeons who did facial plastics along with ENT. So what I've done is I've tried to incorporate facial plastics in ENT. So you'll ask me why this unusual combination. So what is cosmetic surgery? Cosmetic surgery is surgery done neatly. So basically what we are doing is all the operations on the face with minimal scars, and they're put in the skin creases so it's not visible. So this is a new thing in ENT.
So could you just tell us a little bit more about the surgeries that you perform and the conditions that you treat?
Yeah. So I was appointed as initially pediatric otolaryngologist and head and neck oncologist at Liverpool University Hospital. So I cover like thyroid, parathyroids, head and neck oncology cases like cancers of the tongue and even of the larynx. In children, I cover most of the airway problems that the children face, and any congenital issues that they have, I would treat. That would include tonsillectomy, adenoidectomies, cleft lip, cleft palates, and also airway issues. Later on, I was appointed at Chelmsford at Broomfield Hospital as a general ENT and facial plastic surgeon. So I did 3 days in a week NHS work and 3 days doing cosmetic surgery. So I also do facial plastics like facelift, rhinoplasty, blepharoplasty, Botox, fillers. And what I've done is I've incorporated all these into basic ENT so that patients have operations done with minimal scar. Say, for example, parotid tumors. They can be excised with a facelift incision. So you'll not be able to see the incision at all.
So the American hospital in Dubai must be a fantastic place for you to work, since they've got a huge pediatrics department and they're one of the largest cancer centres in the UAE as well, isn't it?
Yeah. See, I've worked in nearly 25 hospitals in my career.
Yeah.
I think the American hospital has one of the best managements.
Wow.
Okay. They are really well-managed team. They look after their staff.
Yeah.
Okay. They have all the facilities available. And the most important is their marketing is so good that I don't have to look for a patient base. If you sit in the clinic, you get patients. The other important thing is we have a lunch break, which I have never had in any hospital. And during this lunch break, which is about an hour, 30 minutes are spent in discussing multidisciplinary team meetings where various conditions are discussed. So it's also an academic center. We also have time off given for academics. We are also paid to attend various courses. So there's a lot of academic activities going on despite it being a private hospital. And they also pay for the traveling allowance to attend these courses, which very few hospitals in the world pay.
So what was it that made you decide to relocate to Dubai?
So I worked for about 20 years in the UK. Yeah. And then because of family commitments, I decided to go back to India. This is in India, what happened is I went to Kolkata, where it was catering to a population of 350 million. And there were 150 million coming from Bangladesh. So that is 500 million. So this gave me a great exposure, and whatever I'd learned in the West, I could implement and practice and hone my skills. Yeah. After 10 years in India, my children have settled in the UK. So I was on my way back to the UK. So my colleague who's working in Sharjah told me, why don't you try Dubai? So I came, and my idea was it's a very hot country, but I came in the winter months and I was really pleasantly surprised that the weather is so good in winter. Not only that, I was impressed with the infrastructure, fantastic. All my colleagues were either trained in the UK or in the US, so it appeared as if I was in UK itself. And most important, the hospitals were up to the mark, very good. And it's tax-free, so yes. I couldn't believe it.
Yes.
So that's what made me decide to work here.
So what would you say are the main differences working here in the UAE compared to working in the UK?
So when I was in the UK, I was undergoing a training program, and it has got one of the best training programs in the world.
Yes.
The NHS as a government service is second to none. Even when I became a consultant, I enjoyed working in the NHS because one of the advantages in the NHS is the patients keep coming back to you. And this is where we learn. We don't learn in textbooks. We only learn when your patient comes back to you. And this is the biggest advantage of the NHS, where every patient can come back to you again and again without any restrictions on payment. I think that's the main thing. Dubai has a different advantages. One thing is most of my colleagues are either trained in the UK or in the US or in Europe. So it feels at home. There's not much difference. It's just like running a private practice near London. I had a private practice. This is very similar to it. But here in Dubai, they are well organized. And these private hospitals are much bigger than the private hospitals in the UK. Academic-wise, they have numerous courses in Dubai. So it is possible to enhance your skills.
Since you've relocated to the UAE, have you still had the opportunity to get involved with teaching medical students and other doctors in the region?
Yeah, not only, see, teaching and learning is part of life. Okay.
Yeah.
So what I have done here is I teach a lot, we get a lot of medical students. I'm also the associate professor in Sharjah University. I've also published papers and give lectures. And as some of the operations that I don't do, if my colleague is doing an operation, I go to his OT to assist him or to observe what he's doing. So this way, there's plenty of scope. Moreover, American Hospital gives you enough time. Yeah, there is time allotted to attend courses. There's time, money allotted for you to attend various courses abroad. I was also inquiring about robotic surgery. They're happy to sponsor the doctors to be trained in that particular specialty. So this is a big thing. So I'm learning all the time, and the medical students and my own colleagues, we work together. So if there is an interesting case, we will go and discuss. So that itself is a learning. The other opportunity is because during lunch break, we have this MDT meetings with different specialties. You're learning a lot.
So you've got a strong track record with research in your career. Since being in the UAE, have you had the opportunity to continue being involved in research activities?
Yes, because I have plenty of time despite working 8 hours a day. Whatever operations, I keep a record of. This is more of a habit. And I do publish.
Yeah.
So whatever records I have, I publish. And every hospital that I've worked in UAE, they have a research and ethics team, and which encourages you to publish. And I've got about 550 citations on my research, and thanks to the hospital that's been encouraging me. And I'm also a member of these ethics committee in various hospitals that I've worked.
And how was your experience working with Allocation Assist?
I will give you 5-star. 5-star not because that you have organized and given us the opportunity to join a particular hospital. It is the whole process. It was so easy since I met you. Application was simple. How to answer in the interview, what to discuss even regarding the salary, what are the benefits you would get in the job, and everything about the hospital before I could join. I also knew a little bit about my colleagues. So thanks to all the information and groundwork which was supposed to be done by me, it was all been done by Allocation Assist.
Thank you so much.
Thank you
So much, Dev.